Welcome again to Grace on Telehealth. My name is Dr. Victoria Ngozi Obuji. We are here to discuss another fascinating health topic that affects mostly women. It also affects men, but mostly women. The moment people hear about it, they think it's a death sentence. Actually, it's preventable, or let me not say, the prognosis is highly dependent on early diagnosis. And early diagnosis is dependent on knowing what to do. And that is why I am here today, to help us know how to detect this condition, that the moment you hear about it, you just think, oh God, I'm there. So I don't know if you have had friends or family members or your colleagues that had been diagnosed of breast cancer. Remember, just hearing about it, how scary is that? That is what I am here to discuss. How we can help to create the awareness, how we can help to detect it early enough, since the prognosis, that means the outcome, is dependent on how early is detected. So we're here to talk about breast cancer. All right, welcome back. I remain yours, Dr. Victoria Ngozi Obuji. I am the anchor of Grace on Telehealth. The goal is to have as many people as possible know what to do to prevent breast cancer. And that is why I am here today, to create the awareness about early detection of breast cancer, so that we can live a little longer if possible. So now the question is, have you ever seen anyone diagnosed of breast cancer in your family, at your workplace, your friends, or within your network? If yes, how did the person feel? What stage was it diagnosed at? And how was it initially detected? And by the way, what is breast cancer? I will take it from what the research says. It says that breast cancer tumors develop when breast cells mutate and grow. That's when the breast cells have abnormal growth and just start to multiply, rapidly. That's breast cancer. And the research also shows that breast cancer is one of the most common cancers that affects women and people that were assigned female at birth. So it happens when, like I said earlier, the cancerous cells in the breast multiply and become tumors, and that is breast cancer. And breast cancer can be invasive. That means it has started affecting the other parts of the body. And the research shows that about 80% of breast cancer are invasive. Is that not ridiculous? 80% of breast cancer is invasive. That means 80% of breast cancer has the tendency, spreading to other parts of the body. So it can spread from the breast to the lungs, to the brain, to the bones, all over. So what are the symptoms of breast cancer? What do you see and start to show some concern that, oh my God, I need to get help? What's happening? One, when there is change in the size and shape of your breast. That is why I advise every woman to make sure they know their normal breast size and shape. That means look at yourself on the mirror when you're not wearing anything. Remember, this is your body, right? This is your body. So you should be able to look at it on the mirror to know actually what your body feels like, mostly your breast. When you feel a lump, when you palpate your breast and feel a lump, don't just ignore it and say, oh, maybe it means nothing. Any lump is a potential for something serious like cancer. Any lump in your breast. When you feel some lump under your breast, like towards your tailbone, your breast, the tail of your breast towards your armpits, mostly during your period, it's time to show concern. Again, when you look at the skin of your breast and feel, it doesn't look normal. Or when you look at your nipple and feel that something seems to be off, or you feel some dimple. Dimple is when the skin goes in, like some people when they smile, you feel their cheek go in. That's a dimple. When you feel something like that on your breast, you feel there's some scaly, sometimes like some people have eczema or something, you will see something like that on your skin. Or when the color starts changing, you see something that looks reddish, purplish, or that part of your skin looks darker than the rest of the breast skin. So it's a time to show concern. And when you palpate your breast and you feel a spot is hard, you just touch it. It's really hard and it's dense. Stays just right there. It's not like a lump that is moving around. That's a time to have problem. Or when you press your nipple and you have some bloody discharge, all those are concerns to just run. Look for the nearest doctor. That if your primary care doctor is not available, just make sure you see a care provider, even if it means going to the emergency room, going to the urgent care, but make sure you try to reach your primary care doctor first. So one may ask, what causes breast cancer? That's $1 million question everybody have been trying to answer. What causes breast cancer? Like I said, the research shows that breast cancer happens when the breast cells mutate. They just mutate and become cancerous. So another question will be, what triggers these cells to start to just divide and multiply so rapidly? There is no particular reason to be given why that happens, okay? But the research shows that there could be traceable risk factors, such as when a woman is like 55 and older. Like I said earlier, if your gender is female at birth. Again, family history. If your parents, your siblings, or even you are a mother, your daughter just suddenly develops breast cancer, it's time to check yourself out. When your close relatives like your aunties develop breast cancer, then there is strong risk. The risk is very high that you may develop breast cancer. So it's time to watch yourself. Again, genetics. It runs in the gene. So research says that up to 15% of people with breast cancer disease in their families develop breast cancer. Again, the research shows that up to 15% of people with history of breast cancer in their families are at high risk of developing breast cancer. Again, smoking is not good. It does not just affect the lungs. It does not just affect the heart. It increases your risk, to develop breast cancer. Obesity. We talked about obesity in one of my sections. Obesity can increase your risk of developing breast cancer. That means watch your weight. Continue to be active. And radiation, exposure to radiation. You may be treated for one reason or another condition, radiation, and that could impact your risk level to develop breast cancer. Okay. And then hormone replacement therapy. Using hormones to treat one condition or the other that is high, like estrogen and other, can affect your risk of developing breast cancer. So now the $1 million question is, how do we prevent breast cancer? It is your responsibility to help in early detection of breast cancer by self-breast exam. Mostly for people that are seeing their period, immediately after your period. I advise after taking a shower when you're still naked, just get this arm up. If you want to do the right, this is my right breast. Get this arm up, check the tail of the breast that's towards the armpit. Make sure you check there. And you see how I have my fingers? That's where you palpate, you go around. Make sure you don't miss any spots of the breast when you're doing that. You have to do that till you get to your nipple. Press the nipple, make sure there's no discharge, and you turn over to this one and do likewise. Okay? And then mammogram. Some insurance companies approve annual mammogram and some approve biannual mammogram. But whatever you do, make sure you do your mammogram if you're within the age range of doing mammogram. And if there's any abnormality and you're asked to follow up with a repeat mammogram, please do not joke with that. Do not joke with that. So do your self-breast exam and do your mammogram. Those are two most common ways that, breast cancer can be detected early. Again, your doctor may ask you to do a sonogram. They may ask you to do MRI. They may decide to do a breast biopsy if there is any concern for, or if there's any lump. The essence of the biopsy is to know if it's just benign. That means, it's nothing to worry about, or if it's cancerous. And again, if they ask, whatever your doctor asks you to do, based on the outcome of your mammogram, your ultrasound, biopsy, or any of those, please make sure you follow. So do not take it for granted. Okay? Again, today we talked about breast cancer. We did define breast cancer. We did talk about the signs, what you see that is a concern, and how to prevent breast cancer. Breast cancer is a very vast topic that we cannot just finish it in one episode. But the most important thing is to create the awareness, to let you know as a woman that you need to do your self breast exam and you need to do your screening mammogram. That is the only way to have breast cancer detected early. And that is the only way to increase one's chances of survival with breast cancer. Again, if you have not subscribed to my YouTube channel, please do so right away. If you have not shared this video, please do share it. The goal is to create the awareness about breast cancer, as many people as possible, so that we will know what to do, we will know what to expect, and we can help some other of our friends, family members, colleagues to be proactive about breast cancer. Again, this is Dr. Victoria Ngozi. See you in my next video. And thank you for viewing. Did you enjoy what you just watched? Then subscribe to my channel and share this video, because you never know who might benefit from it. I'll be dropping health updates every Wednesdays and Saturdays, so don't miss any. See you next time. Cheers.